problem. Okay.
Hi, my name's Larry Guffey. In 1993, I had a heart transplant, and in the process of taking anti-rejection drugs, which are necessary in order to maintain the heart transplant, these drugs have negative side effects, and they started working negatively upon my kidneys. And my kidneys got to the point after 12 years that I was going to need dialysis and eventually a kidney transplant. The doctors felt that I would be a good candidate for a kidney transplant, being I had already had a heart transplant. And when they scheduled the surgery for putting in the shunt in my arm, before that happened, I started taking Pro-Arginine approximately 3 weeks before the scheduled surgery. When I went back, the doctors, of course, did another blood test and said that my kidney deterioration had sort of stabilized, and that it would be a while before I would have to have the shunt put in and do the dialysis. So he said, come back in 3 months, and 3 months passed and I went back. Of course, he did another blood test. He said, I've found that your kidneys not only have stopped deteriorating, they have improved a little bit. He said, so what I'm going to do is I'm not going to put the shunt in, and we're not even considering a kidney transplant at this point. He said maybe eventually you might have to have one. This was a little over 2 years ago. And three months ago, my last checkup with my nephrologist, my kidney doctor, he told me that my kidneys had stabilized to a point to where they were in the stage 3, which is almost normal. Stage 4 is normal, and that my kidneys were improved to the point that they were better than he had ever seen them since he had started taking care of me 14 years ago. With this in mind, I was very elated and very happy that I would not have to have a dialysis or a kidney transplant. But not only did the Pro-Arginine, which I was taking faithfully for those few months and 2 years ago, have made my kidneys improve. In a heart transplant, when my nerves were severed from my heart to my brain, and they said I wouldn't be able to ever feel another heart attack if I had one, or angina or anything like that, or would not have the fright-to-flight syndrome, I went to Dr. Joe Pendergast, and he gave me an autonomic nerve test, and he said, Larry, your nerves to your heart and to the brain have grown back. And I had known that all along because I started the fright-to-flight syndrome. And not only does it regenerate those things in your body that are not healthy, it also continues to make the heart and the plaque dissolve in your system. Having high cholesterol, I was on a lot of cholesterol medication. And since I had started on the Pro-Arginine 2 years ago, I have dropped all of my cholesterol medication, and I'm only using the Pro-Arginine now. And my cholesterol count is just as good now, or even better than it was when I was on the medication. So that's basically the story that I have to tell, and I hope that everybody will understand that this is probably the real miracle molecule that Dr. Joe talks about. And if you have problems with cardiovascular disease or circulation or kidneys, please look into using this product. Thank you very much.